Good afternoon and welcome to our presentation entitled Exploring Oral Therapy with ZAVESCA, 7-Year Clinical Experience Update. The objective of this meeting is to examine the type 1 Gaucher disease oral treatment option, ZAVESCA, from the clinician, nurse, and patient perspectives. A very brief rundown of the agenda. We'll hear from Christine White, the president of the National Gaucher Foundation of Canada. We'll then talk about some specific patient profiles or the ideal candidate for ZAVESCA from Dr. Dominic Amato. Margaret Mackerel and Marianne Patterson will talk about a patient support update, and then we'll hear a few pre-recorded messages from a patient perspective. I will qualify for the Q&A that the patients are not available today, so you can't submit questions to them. But in addition to the panel that you see on this agenda, we also have Monica Bailey from McKesson available at that Q&A if there's any questions about financial support or reimbursement. So we'll wrap up with that Q&A and then close out the meeting with a few remarks from Christine. So without further ado, I'd like to introduce the president of the National Gaucher Foundation of Canada, Christine White.
Excuse me. Hi, everyone. I'm really excited to be here today. In keeping with our mission to support patients through education, community building, I'm pleased to welcome you to what I'm sure will prove to be a very informative and worthwhile session. I have a few brief updates on some of the projects we've been working on at the NGF over the past few months. The first being we're conducting a survey to gather information on issues Gaucher patients face getting access to insurance. We've heard anecdotally over the years of the various problems patients have encountered, and our goal is to collect real data that we can analyze and then report our findings back to the community and ultimately make some recommendations which may help you get access to insurance. Participation in the survey is completely anonymous. There'll be no identifying information will be published. So I encourage you all to participate. The survey will be sent to you via email, and if you're not on our email list, there will be a link on our website effective January 26th. I encourage you all to take a few minutes to complete the survey. It'll take approximately 5 minutes, but the material we collect will be invaluable for us, I believe. The link's at the screen at the bottom there, but I don't know if you have time to copy all that down, so that will be on the website tomorrow. Another thing I'm really excited to announce is our upcoming patient conference. That's going to take place in Ottawa, again, in October of this year. It's a great opportunity for patients to gather and to meet other patients and while learning the very latest information on Gaucher disease management. I encourage you all to attend. As in the past, we do have funds available to provide scholarships for one participant plus one patient plus a companion, an accompanying companion. We'll cover the cost of travel to get to the event. I'm also really excited about it to announce that on April the 11th, we'll be hosting a gala, our first ever fundraising gala in Ottawa. This is going to be also an awareness campaign. Our guests will be treated to a tasting menu from 6 of Ottawa's top chefs, as well as we'll have some wonderful live entertainment. Tickets will go on sale shortly and will be available on our website. Again, if you can take a look, and I encourage you, if you're available, to come to what will be a wonderful evening. We recently conducted a survey with the aim of identifying unmet needs experienced by patients currently being treated with ZAVESCA. Patients, parents, and partners met one-on-one with a facilitator, and through a series of questions, we learned how having Gaucher disease impacts a patient's daily life. We learned that without exception, patients were very satisfied with their current level of support and access to care, and there were no glaring unmet needs identified. Patients were happy with their treatment with ZAVESCA, so much so that they're willing to share their experiences with you here today. You'll have the opportunity a little later in the broadcast to hear from them. And I think that's it for me. I will turn now over to Dr. Dominic Amato for this presentation. Thank you.
Thank you, Christine, and welcome to everyone who's on the who's online. I'm Dom Amato, Director of the Mark Friedman and Judy Jacobs Program for Gaucher Disease based at Mount Sinai Hospital in Toronto. And any of you who are patients, I think, already know me. I was asked to outline the profile of the appropriate patient candidate. And my first response to that is there's really no single profile that would fit all eligible patients. So for example, if you want to look at the product monograph, the actual approved indications are adult patients, that's between 18 and 70 years old, with mild to moderate type 1 Gaucher disease, for whom enzyme therapy is, and the quotes, not a therapeutic option. And the examples that are given in the product monograph are allergy or hypersensitivity to enzyme, or poor access to veins. However, we have a patient who's well over 70, who's been on it now for 6-7 years, and is having no problems with it. These examples that are given are not the only reasons why enzyme therapy might not be a therapeutic option. So, for example, we have patients who were on one of the original ZAVESCA trials. These are patients who were initially on Cerezyme, switched to ZAVESCA for the trial, and 2 of them are still on it. We've got a couple of other patients for whom enzyme therapy was inconvenient. They were going off to university and didn't want to get IV treatments every 2 weeks. They had been on enzyme therapy for several years as children and young adults, and then at the time they turned 18, they asked to switch, and they've been on it now for a couple of years. We've got one patient for whom the private insurance was unwilling to pay for enzyme therapy, but was willing to pay for ZAVESCA. So that's another patient who's still on it. We've had another patient who, despite the fact that we increased her enzyme dose and kept increasing it, her bone pains did not go away. So we've switched her to ZAVESCA with a remarkable outcome in that the bone pains seem to have gone away for the most part. Other instances might be if you've got patients who have a long distance to travel for enzyme therapy, or for whom who live way out in the boondocks and don't have access to someone to come in to their home or a hospital nearby. Finally, if a patient is unwilling to have IV treatments, for example, if they have a phobia for needles, although I must say that most of our patients, even though they have a phobia for needles, they have to get blood tests done every so often anyway, so that's not a major issue. So just to summarize our experience with ZAVESCA here in Ontario, we've had a total of 12 patients on ZAVESCA starting back in 2006. 4 of them have discontinued it, mostly because of tremor or paresthesias. Paresthesias means pins and needles sensation or tingling sensation. And we have, so 8 of our patients are still on ZAVESCA, and they've been on it for a period of anywhere from 1.5 for the shortest to more than 8 years for the 2 longest. And I think that's the end of what I have to say.
Thank you, Dr. Amato. Just a brief reminder, if there are any questions you'd like to submit in the bottom right corner there, please just post them to the Q&A chat window, and we'll address them at the end. I'd like to introduce Margaret Mackerel, who is the Lysosomal Storage Disease Coordinator at the Hospital for Sick Children, and Marianne Patterson, who's the Nurse Coordinator at the Mark Friedman and Judy Jacobs Program for Gaucher Disease, and they will be providing us a patient support update. Marianne and Margaret?
Good afternoon, everyone. My name is Marianne Patterson, and I'm the Nurse Coordinator at the Mark Friedman and Judy Jacobs Program for Gaucher Disease here at Mount Sinai Hospital. So as you've heard from Dr. Amato, after you've had your discussion with your Gaucher team and ZAVESCA is going to be considered a therapy, there are also other things to consider before initiating ZAVESCA therapy. of importance, a discussion in regards to fertility, pregnancy, and lactation. Female patients during their childbearing years should consider a reliable method of contraception while taking ZAVESCA. Pregnancy is contraindicated. Also, ZAVESCA should not be used by nursing mothers, that is, breastfeeding mothers. Male patients should not father a child while taking ZAVESCA and for 3 months after taking the last dose of this drug. And you may wish to suggest that your female partners also consider reliable contraception. ZAVESCA is not indicated for patients over 18 years of age, under 18 years of age. Again, things to consider before starting therapy. ZAVESCA, like any medication, may cause side effects. These are some of the things you need to know. Common side effects, that is gastrointestinal side effects, could include weight loss, diarrhea, gas, abdominal or stomach pain, and nausea. There are preventative measures to combat these gastrointestinal side effects. Patients taking ZAVESCA often benefit from preventative nutritional counseling by an experienced nurse or dietitian. Before starting ZAVESCA, it may be of benefit to adjust your diet. You will be counseled to limit your intake of carbohydrates. This would include things like bread, cereals, potatoes, pastries, rice, pasta, and also to limit foods high in sugar such as desserts, certain fruits, and certain types of sugared fruit drinks and soft drinks. Commencing dietary modifications beginning at least 3 days or up to 2 weeks before starting ZAVESCA may reduce GI side effects. Also, a probiotic such as Florastor may be recommended to maintain gastrointestinal health and minimize side effects. Again, things to consider before initiating therapy. And as with other medications, we talked about the common side effects. There can be some serious side effects that may include neurological problems. And in terms, it could be neuritis or neuropathy, which really indicates some sort of irritation to the ends of the nerve fibers, and that would be of hands and fingers and toes. And this may manifest itself by tremor, numbness, or tingling. Your healthcare team will determine if a neurologic assessment is advisable prior to initiating therapy to assess for any pre-existing neurologic conditions. One of the most important issues before considering starting on ZAVESCA, in preparation, it is important to establish an open line of communication with your Gaucher team. This can be accomplished through an agreed-upon method such as email, text, or phone. Having a direct communication link ensures a timely response to answers and concerns. So you're about to embark on starting ZAVESCA therapy. ZAVESCA is an oral medication. The usual dose is 100 milligrams, or that is 1 capsule, 3 times a day, taken 3 times per day. The initial dose of ZAVESCA may be titrated up or down, for example, starting with 1 capsule per day for a week and proceeding on slowly to achieve the usual recommended dose. If you have a dose modification may be required initially, depending on the side effects you're experiencing. That is, if you're having any GI side effects or tremors, your dosing may be up or down while those symptoms are ameliorated. If you have a problem with the filtering ability of your kidneys, you may receive a lower starting dose of ZAVESCA. ZAVESCA capsules should be swallowed whole with water. They should not be chewed or opened up. Again, starting ZAVESCA therapy, it's important that you keep your healthcare team aware of any side effects you are experiencing. This includes reporting any GI disturbances such as diarrhea, weight loss, severe nausea, and/or abdominal pain. You will be asked to monitor your weight to ensure you are tolerating your medication. Also, you need to report any neurologic symptoms such as tremor, tingling, burning in the hands, arms, or feet. It is important, very important, to report side effects immediately. The specific GI disturbances can be managed with the following strategies. Diarrhea can be managed with the use of over-the-counter or OTC anti-diarrheal medications such as loperamide. Also making some dietary changes such as limiting complex carbohydrates according to the dietary information you were given. The dietary changes may alleviate some of the loose bowel movements you may experience. The risk of diarrhea may be reduced if ZAVESCA is taken between meals. Weight loss is another consideration and is a disturbance. And weight loss with ZAVESCA is common and will be monitored. Average weight loss is between 6 to 7% of body weight over 12 months. Your weight generally stabilizes after this period of time. You can help minimize weight loss by ensuring adequate energy provision through additional dietary proteins such as meat, fish, and eggs. Flatulence or gas and abdominal bloating, if bothersome, can be alleviated by over-the-counter products such as Gas-X or products that have simethicone in them. A key point to remember is that side effects vary between individuals. In our experience, most had mild GI effects and were able to return to their normal diet after several weeks. Thank you.
Right. Oh, thank you, Marianne. My name is Margaret Mackrell. I'm the Research Nurse Coordinator for the Lysosomal Storage Program from Sick Kids Hospital, and I'm going to discuss the patient support services available through McKesson. So there is reimbursement support available for ZAVESCA through private or provincial healthcare plans across Canada. In Ontario, the Exceptional Access Program, or EAP, as commonly known, facilitates patient access to drugs not funded on the Ontario Drug Benefit Formula or where no listed alternative is available. Actelion, the manufacturer of ZAVESCA, has partnered with McKesson Canada Pharmaceutical Solutions to help patients navigate through the reimbursement process. McKesson investigates both private insurance, if applicable, and the public-funded programs. This program is called the ZAVESCA Patient Support Program. The patient simply signs a registration form to start the process. McKesson ensures the confidentiality of patient information, and the patient information will not be released at any time without the specific consent of patients. McKesson also nicely facilitates the delivery of the drug to the patient's home. This is an example of some patient support materials. As Marianne just mentioned, the dietary counseling prior to starting ZAVESCA is important. So there's a particular brochure that looks at diet, and the next brochure is a physician-generated document looking at Gaucher disease and use of ZAVESCA. This next slide looks at the algorithm of steps involved in prescribing ZAVESCA through the patient support program. So just a few final thoughts in summary. It has been our experience at the Mount Sinai Hospital in the adult Gaucher population that patients adapt nicely to ZAVESCA over the first several weeks of treatment. We recommend that you educate yourself to make an informed decision with your healthcare team to see if ZAVESCA is an appropriate choice of treatment for you. And lastly, successful outcomes while using ZAVESCA are facilitated by a close partnership with your Gaucher healthcare team. We want to thank you for your attention and thank you for joining us today.
Thank you, Marianne and Margaret. The next portion of our presentation is a summary of market research from the patient perspective. We'll now listen to 3 pre-recorded stories from patients who are currently on ZAVESCA.
Dawn, I was diagnosed with Gaucher disease when I was about 4 years of age. That's when they finally found it. At the age of 3 is when all the symptoms started coming out. The stomach was enlarged. The doctors kept saying it was just all baby fat and that I would outgrow it as I got older. But by the time I started school, which was almost 4, I noticed I had pain and stuff, and I was telling my parents, and they were like, nope, something's wrong. So they sent me to a doctor, and they ended up sending me to the master because the original diagnosis was leukemia. But they said that they found something different that they haven't really seen. So they did another set of blood work, and they realized, they sent it away, that it was Gaucher disease. Now, at the age of 7, they took my spleen out to help with the enlargement of the stomach. When I first received treatment, it was in the summer of 1993, just before I started high school. It was an IV infusion every 2 weeks. And at the hospital, for 14 years, the last 5 years of that 14, I was doing it at home. The infusion was being done at home for the convenience for myself and my family. I decided to switch to the oral therapy instead of using the ERT. I found that I was still experiencing the bone crises, the bruising, the pain. With the infusions, I've had no energy. The main reason for the switch was that I didn't want to take the pain medication. The problem with the pain medication was that I was kind of loopy. I couldn't focus on anything. I wanted to sleep more than to spend time with the family or to go out and do things. And I found that if I wasn't on these medications, on these pain medications, maybe I would be a better mom and be out there and be more into what my kids were doing in their lives than worried about what I'm going to be doing. I met my husband in 1996. He would come to all the infusions and all the appointments, and he would always say to me that one day there will be a magic pill, so no more needles, no more poking. When I decided to switch, I spoke with my husband to see how he felt about it, and he seemed to go for it. He said, well, let's give it a try. It'll work. This has got to be better than what's going on right now. Between him and I, we've discussed it, and we decided to do that. The doctor did mention to us a couple of years ago about retrying the oral therapy, and at that point in my life, I wasn't sure if I was ready to even try it, to even give it an idea, to even think about trying to use it yet. Since I've started the therapy almost 2 years ago, I definitely do feel a lot better. I feel like a normal person. I don't feel like there's any medical problems, actually. The bone crises are like next to nothing. If I haven't had any in such a long time, I definitely think that this medication is what I should have done in the beginning. I wish I would have started it earlier than later.
My name is Jerry. I was born on March 9th, 1947, so I'm 67 years old now, and I have Gaucher disease. I was first diagnosed at 1. The doctor noticed protruding liver and spleen, and so the diagnosis was made, but of course there was nothing that could be done and very little knowledge about the effect of Gaucher's. I grew older. The Gaucher's affected me because of my enlarged liver and spleen. My chest was pushed out. My stomach was always tender, so if I fell down, it would really be painful. It also affected my right leg, which was shorter than my left. My foot is twisted, and it's spastic, so I have a limp. In April of 1967, I suffered an infarction in my spleen, and I was hospitalized for 5 weeks. They took it out. It was over 5 pounds. But after that, I felt a little better, I guess, maybe because there wasn't as much pressure on my abdomen. But, of course, the Gaucher cells continued to accumulate, and this time they accumulated in my liver, and my liver became grossly enlarged. I graduated from U of T with an honors BA in political science in 1970. I went to law school and graduated in 1973. Also in 73, I married my wife, and she had been tested for Gaucher's, and she was not a carrier, so we didn't worry about our children having it. We have one daughter who was born in 1978, and of course doesn't have Gaucher's. The next problem I had was in 1989, in February, when I had a heart attack. Subsequent to that, I had a lung bleed in October of 1989, and then a second one in June of 1990. They suspected pulmonary hypertension. In the early 90s, I became aware that there was a treatment for Gaucher's. I had met Mark Friedman, who lived not far from us, and I knew that he was involved in trying to get the government to fund Gaucher. It was $500,000 a year for treatment, and the government was reluctant to do that, but he had a much more severe case than I had because he was having bony crises and he was getting quite crippled with the problems. But he was able to convince the government of the day that this was worthwhile treating Gaucher's patients. In November of 1995, I had some minor surgery, and I had a lot of bleeding at that point, and my hemoglobin count was down to 79, and I needed blood transfusion. So in early 1996, Dr. Amato and I talked about going on this, and he felt that I was a candidate for this, given all of the problems that I have. I began the enzyme replacement therapy. It was very effective for me. I had no side effects from it. My liver shrank. The cirrhosis was reversed. My hemoglobin went up to normal. For the first time in my life, I could look forward to maybe a normal life. It was very encouraging. I was on that for 10 years. In 2006, this oral form, ZAVESCA, had been developed, and Dr. Amato had been asked if he could do a study to see the effectiveness of this drug. We talked about it, and he felt that I was a candidate to go on the oral treatment, and I was quite pleased with that because, of course, I wouldn't have to go in one morning every 2 weeks for the treatment. He did say that they were finding that people had side effects. One of them was gastrointestinal problems. Some people were getting tremors from it. So you had, obviously it had to be studied. So initially I was advised by a dietitian as to the kind of diet that I was supposed to follow, make sure I didn't have any problems. So I did that for a little while and then went back to my regular diet, and really I haven't had any issues like that. I've had stomach upsets and I've had, other issues, but periodically, but nothing consistent that I would say, well, this is because of the drugs. So I certainly haven't had any tremors. So if you're on the enzyme replacement therapy and you're thinking of going on the ZAVESCA, initially you should follow with the diet that is recommended, and if you can tolerate going back to your regular diet, that'll be great. And you have to be checked to make sure you're not getting any other adverse side effects. But if you can tolerate it, it's certainly a lot more convenient and it's a lot cheaper for the system.
My name is Allison, and I'm 21 years old, and I'm right now in my 4th year of university. I was first diagnosed with Gaucher when I was about 4 years old. I was in the hospital with a kidney infection that had stemmed from a bladder infection, and I had blood work done that was considered abnormal. And once the infection was gone, they checked it again, and it was still abnormal. So they sent me in for some testing and realized that I had an enlarged liver and spleen, and realized after going through a few possibilities that I had Gaucher disease. And then they ended up finding that in my identical twin sister as well, upon my mom's insistence that they check her too. They couldn't give me any treatment at the time though, because basically I wasn't suffering enough is, I guess, the basic principle behind it. There really wasn't much they could do unless I had a real physical problem because of this disease, or really they weren't going to treat it until it was serious. So when I was about 5 years old, I got out of bed and I couldn't walk, and I just kind of fell down because I had a really searing pain in my hip and down my leg. And I went to the hospital and I was diagnosed with avascular necrosis in my hip, which basically means that my bone was kind of being eaten away. So as a child, I received treatment right around after I got my avascular necrosis and I was released from the hospital. So I was probably around 5 or 6 years old, and it started with an enzyme replacement therapy. I really did make the decision to switch from enzyme replacement therapy to an oral therapy simply because I was in grade 12 and I was 18, and I was really getting ready to go away to university far from home, and I always known that I wanted to be able to take an oral medicine instead of an infusion, knowing that someday I would be leaving and not be able to get these home treatments as comfortably as I had been. And I knew it would be the most convenient for my life, and I didn't really want to have to run off to the hospital every 2 weeks to get an infusion. That would just get in the way of school and my studies and my social life and everything, and it would just be so much easier to live my life without Gaucher to get in the way with it if I could just take an oral medicine instead of getting this enzyme replacement therapy through infusion. But it really was, at the end of the day, it was my decision. My parents were obviously supportive of whatever I chose. They were, I think, a little bit nervous as to whether I'd be able to make the transition between treatments successfully, but I've never had any problems with it. I was told side effects-wise, I could experience a lot of digestion problems and issues, especially if consuming lots of sugar, carbs, and dairy and things like that. And I really haven't noticed that being an issue. I did change my diet for about a week after starting the medicine just because I was concerned. I didn't want it to be an issue, but after about a week, I just kind of gave up on using the diet, and I really haven't noticed any issues with it. And I was also told that I might have problems with bruising and things like that just because it doesn't keep the platelets quite as high as an enzyme replacement therapy, but I really haven't noticed that being an issue either, so I don't have any regrets about it.
We have several questions that were posted, which we'll get to with the panel now. Just a quick reminder, if you have any questions you'd like to ask, please post them in your chat window, send to Q&A, and if you could post those now, we'll get to them in order of those submitted. So to start, Dr. Amato, can you please discuss the neurological issues that were identified?
So these have already been mentioned, but I'll elaborate a bit on them. The first is tremor, and I would say quite a few of most of our patients have had some degree of tremor. There's only one patient that had to discontinue this. When we started this ZAVESCA study back in 2006, we had 5 patients enter the study, and one of them dropped out after about 3 months because of severe tremor. The others stayed on for the full 4 years of the study. So tremor can be mild, and when it is mild, most patients learn to live with it, or it can be more severe. So but in neither case is it irreversible. So you can stop the drug or decrease the dose, and usually the tremor gets better. As far as the more serious neurological effect, that would be a neuropathy. That's where there's actual damage to the nerves, and we've only had one case of that out of the 12 patients that we've had on ZAVESCA altogether in the last 8 years. Only one patient has had neuropathy and has had to discontinue it because of that. So those are really the only neurological side effects or issues.
Thank you, Dr. Amato. Marianne, can a 17-year-old successfully change from ERT to oral therapies?
Well, when you look, as Dr. Amato mentioned in his presentation, the product monograph and, of course, the treatment guidelines that are available in Ontario all indicate that it's for adults 18 years of age and older. So the first answer is no, you can't start at 17, but you can prepare starting from 17 until you reach your 18th birthday. And knowing what you know about ZAVESCA from today, there is some preparation that needs to be done, particularly issues around fertility. So if you're a female wishing to soon embark on ZAVESCA, you will need to have a gynecologist appointment to assess for some sort of contraception. If you're a male, you will need to, and you're in a relationship, your partner may need to go on contraception. So there are things that you can do to prepare. You can become educated in terms of what you will need to do the diet preparation, to condition yourself for that. So the short answer is no, but the long answer is yes, and you can start early rather than later to prepare for it.
Could I also add that just for the older people in the crowd, that although it says 18 to 70, I mentioned earlier, we have one patient now who's well over 70. She's actually closer to 80. And as you heard the patient Jerry mention, he's now 67, so he'll soon be 70, and so far is on it. So we are definitely going beyond that age range in the patients.
Thank you, Marianne and Dr. Amato. The next question is ZAVESCA approved and funded in all provinces across Canada? And we'll hear from Monica Bailey of McKesson, Canada.
Good morning or good afternoon, everybody. In terms of ZAVESCA coverage across Canada, ZAVESCA has been approved by Health Canada as a therapy for Gaucher's. As Margaret mentioned, in Ontario, you can apply through the Exceptional Access Program, and they will assess and potentially provide you with coverage. Otherwise, we've found across the country that it's very much assessed on a case-by-case basis. But this is where the Patient Support Program can assist you in finding out what you need to complete in terms of documentation and helping you navigate through that process in securing coverage.
Thank you, Monica. Marianne, the next question from a participant is one who would like to know the effectiveness of ZAVESCA versus enzyme replacement therapy. Oh, sorry, and we'll pass that on to Dr. Amato. My apologies.
That's all right. Thank you. So first of all, let me say that like any other drug, people vary in their response to ZAVESCA. As you've heard from some of the patients, some of them have had hardly any gastrointestinal problems at all, and one or two have not had any tremor. So there's a spectrum, you know. At the other end of the spectrum are patients that might have to discontinue because of the severity of side effects. So that's something to keep in mind. As far as enzyme therapy is concerned, there are very few side effects from that. We know that. Some people gain weight after they start enzyme therapy, and other people lose weight when they start ZAVESCA. Now, those things can be double-edged sword. If you're someone who's overweight and you start ZAVESCA and you lose weight, you're probably more happy than sad at that. As far as the effectiveness, if we talk about blood counts, spleen size, liver size, chitotriosidase levels, that's the enzyme that we measure that goes along with the activity of the disease. These things are all a little less effective with ZAVESCA than they are with enzyme treatment. So there's no question about that. Some of our patients have had decrease in their counts, but not to a level that we would consider dangerous. So far, we've not had to take anyone off ZAVESCA because of any problem with effectiveness. It's not, nobody would argue that it's not as effective as enzyme treatment, but so far everybody has stayed on it for that reason, and the ones who have discontinued it mainly because of side effects. I hope that answers the question.
Thank you, Dr. Amato. Marianne, we have another participant who's wondering if they can start ZAVESCA as a first-choice treatment for Gaucher.
Yes, you can start, but first of all, you have to meet the criteria for starting treatment in whatever province you are in. So yes, you can. ZAVESCA is indicated for patients with mild to moderate disease. So it can be used as a first choice. What happens is mostly people that do not want to have IV therapy would choose ZAVESCA as a first-line therapy. So if this is agreed upon with you and your physician, then yes, you can start ZAVESCA as a first choice of treatment.
Thanks, Marianne. This next question is for Dr. Amato in regards to cost. What are the prices of the two available IV enzyme replacement therapies and oral ZAVESCA?
So the first treatment that was available, which is imiglucerase, which is also known as Cerezyme. Now, I must tell you, first of all, I must preface my remarks by saying we are pricing this in terms of a 60-kilogram person. 60 kilograms is about 132 pounds. Now, we round off the thing, so if you're somewhere between, say, 120 and 140, you would be considered a 60-kilogram person. If you're heavier than that, the dose would be higher. If you're lighter than that, the dose would be lower. So my prices are based on the cost of treating a 60-kilogram person at a dose that we consider middle range, that's 30 units per kilogram every 2 weeks for 1 year. And that cost for Cerezyme would be around $320,000 Canadian. The other two enzymes come in a little below that. The third one, by the way, you mentioned two enzymes that are approved. VPRIV is approved. That comes in at around $270,000. And L-Lyso, which have not yet been, well, yes, it has been approved here, but it's not yet, we haven't got anybody on it yet. That would be around $240,000. And then if you ask about ZAVESCA, it comes in at about $120,000 a year. So that's a little more than 1/3 the cost of Cerezyme, which is the most expensive of all. I hope that answers that question.
Thank you, Dr. Amato. Margaret, can ZAVESCA take the place of any of the available ERTs?
Thank you, Craig. Enzyme replacement therapy is recommended as a first-line therapy for Gaucher. However, if you have met your therapeutic goals on enzyme replacement therapy, it may be worth a discussion with your healthcare team to assess whether or not you will be eligible to change to ZAVESCA.
Thank you, Margaret. Marianne, what happens if you forget a dose during the day? Do you double the dose sometime after?
No, what we usually recommend for patients if they miss a dose is just to go on to the next dose at the regular time. What we try and do during that initial stage of starting therapy, because it is a 3-time-a-day dosing, which can be a bit problematic, trying to remember that middle-of-the-day dose. I mean, we all have technology at our fingertips, and what becomes helpful is that on your smartphone or your computer or even your wristwatch that you set your dose time for when you should be taking it in the afternoon. So no, you do not double up your dose. It's a missed dose and you move on to the next dose. Thank you.
Thank you, Marianne. Dr. Amato, will this treatment prevent nosebleeds and bruising?
I don't know. Of our patients that have gone on to it, that have been on ZAVESCA, none of them has had a major problem with bleeding or bruising, or nosebleeds or bruising. So I don't really know the answer to that. Part of it depends on what your platelet count is. And also, a few of our Gaucher patients have problems with either clotting proteins or platelet function, not just the number of platelets, but how they work. So it's an open-ended question. I can't give you a definite answer to it. The only way I could know would be to go on it, because as I say, we haven't had any patients who are on ZAVESCA who had a problem before that with bruising or bleeding.
Thank you, Dr. Amato. And another question for you. This is specific to a transition point. The patient wants to know if they would be able to change over to ZAVESCA from ERT at the Civic Hospital Medical Daycare in Ottawa.
Well, I don't want to answer for the doctors in Ottawa. I don't see any reason why they couldn't change. We certainly have at least one patient in Ottawa who's on it.
And the parameters are disease stability.
Right. Yeah, you have to be stable on enzyme first. You have to be in the proper age group, and I don't see any particular reason why they couldn't switch.
And I think our final question here is, will ZAVESCA halt bone infiltration with Gaucher cells, or will this problem have to be corrected through enzyme treatment before the oral therapy can be considered?
That's a difficult one because bone is the least responsive of all the complications of Gaucher disease. The bone is the least responsive to any kind of therapy. Enzyme therapy can improve bone health, but it takes a long time. It takes several years before you see major changes. As far as the ZAVESCA is concerned, we don't have an answer to that. One of the reasons being there haven't been as many people on ZAVESCA for as long. And I can only say that from an anecdotal point of view, you heard one of the three patients, the first patient who spoke today, mentioned that she had quite a bit of bone pain and was on major pain medication. And since she's been on ZAVESCA, the bone pains seem to have largely gone. So I can say that again, it's an individual question, that it's an individual patient issue, that just like any other drug, not all patients respond the same to any drug. There's going to be there's going to be a spectrum of response, from little response at the low end to major response at the high end.
Thank you, Dr. Amato. And on that note, it looks like that covers all the questions that were posted. Just before we close the meeting, we'll just hear a few closing remarks from Christine White, again, who is the president of the National Gaucher Foundation of Canada.
Thanks, Craig. Thank you so much for participating in today's webinar. I hope you enjoyed it and found it informative. I'd like to thank our panelists, Dr. Amato, Marianne, Margaret, and Monica. You did a great job. And I'd also like to thank our patient participants, Jerry, Allison, and Don. I'm sure many of us can relate to their stories. I personally valued their contributions a great deal. Thank you.